So basically, shared motherhood is an assisted reproductive technique that we can offer to same-sex couples in which one of the women is going to undergo an IVF cycle in which we're going to stimulate her for her ovaries to produce eggs, and then those eggs are going to be taken with an egg collection. Those are going to be fertilized with donor sperm. The embryos will be created in the lab, and we're going to let them grow and develop until they reach the stage of blastocyst. And once they reach the stage of blastocyst, what we're going to do is select the best one to transfer it into the other woman's uterus. And if there are surplus embryos that are healthy, we're going to freeze them for future use. So basically, the shared motherhood is an IVF process in which one of the women donates the eggs and the other one is going to receive the embryos. And the most important things that are different between doing a cycle of shared motherhood and doing intrauterine insemination are that with the shared motherhood, we're giving the couple the possibility that they both participate actively in the process. The second important thing is that success rates are much higher with shared motherhood than with intrauterine insemination. We're speaking about around 50-60% chances of achieving a positive pregnancy test after the transfer of a good quality blastocyst. And when we're doing IUI with donor sperm, the chances of pregnancy are between 15 and 20%. And also the shared motherhood gives us the possibility that if the cycle goes very well and we have embryos frozen, we also can offer the couple the possibility of maybe having another child in the future, or to repeat and do another embryo transfer in the case that they don't achieve a pregnancy the first time that they do the transfer. So basically, this is one of the techniques that same-sex couples really like, because they, as I was saying before, it gives them the opportunity of proactively and actively participate in the process for both of them. So basically, the requirements to undergo a shared motherhood are that both members of the couple are in good physical and health condition to undergo one of those, the stimulation for the ovaries to produce the eggs, and the other member of the couple has to be in good health also to carry a pregnancy. And on the other hand, the other requirement is that the couple must be married or be in a domestic partnership. So basically, what we usually try to do is synchronize the cycle of both women who are going to start the process. The woman who's going to be the donor of the eggs, she will start a stimulation cycle for her ovaries to start producing eggs. She will probably start the medication around the 3rd day of the period, and she will be taking some injections to boost the growth of the eggs in the ovaries. And during the time that she's doing that treatment, she will have to go to the clinic to do some bloods and scans. And that way we can monitorize what's the response of the ovaries. Usually around 10-12 days after she started the stimulation, she will be ready for what we call the egg collection. In the meantime, the one that's going to receive the embryos, she will start an endometrial preparation, which is a treatment to prepare the uterus to be receptive for the embryo to implant. That treatment usually involves starting to take estrogen that we usually give in form of tablets or patches, and usually around 10-12 days after she started that med, she's going to have a scan. On the day of the egg collection, we are going to take the eggs out, we're going to put them with the sperm of the donor, let the eggs be fertilized by the sperm, and the following day we will know how many embryos we have. The same day of the egg collection, the one that is going to receive the embryos is going to start to take progesterone, and 5 days after, once we have the embryos at the stage of blastocyst, the best embryo is going to be selected to be transferred into the recipient's uterus, and the rest of embryos that we have that are good quality will be frozen for future use.